Today, we'll briefly discuss about Centor Criteria for Group A Streptococcal Pharyngitis, and we'll learn an easy mnemonic to remember the components of the Centor Criteria. So this Centor Criteria is a 4-point scoring system, and it is used to assist with risk stratification for Streptococcal Pharyngitis and for the clinical decision making regarding the treatment. So the 4 components of the Centor Criteria are elevated temperature, that is temperature more than 30 degrees Celsius or 100.4 degree Fahrenheit, presence of exudates over the tonsil, presence of cervical lymphadenopathy, particularly the anterior cervical chain, and there should be the absence of cough. So this Centor Criteria was originally validated in patients 15 years of age or older. However, later on this criteria was modified by McIsaac, and this is known as modified Centor Criteria. This criteria is almost similar to the Centor Criteria, but this criteria also provides an age adjustment to the final score. And unlike this conventional Centor Criteria, this modified Centor Criteria can be used in patients 3 years of age or older. These are the components of the modified Centor Criteria and the Centor Criteria. So this, if there is exudate or swelling of the tonsils, patient will get 1 point. Similarly, if there are cervical lymph nodes, patient will get 1 point. If the temperature is high, there will be 1 point. And with cough, if cough is absent, then patient will get 1 point. And similarly, if the age of the patient is between 3 to 14 years, patient will get 1 point. And if it's more than 45, patient will 1 point will be deducted, and there will be no points for 15 to 44 age group. So we can use this mnemonic Centor to remember the components of this Centor Criteria itself, where C is for cervical lymphadenopathy, E is for elevated temperature, N is for no cough, and TO is for tonsillar exudate, and R is for risk of streptococcal pharyngitis. So using this very simple mnemonic, you can remember the components of the Centor Criteria. So now let's move to the interpretation. So if the score is 0, you don't need to test or treat. And similarly, if the score is 1, there is no need to treat or test. And this 2 is the borderline. If the score is 2, then you should start testing. And if the test is positive, you'll treat it with the antibiotics. And if the test is negative, you don't need to treat it with the antibiotic. But with the scores of 3 or 4 or more than that, you can either treat empirically or you can test and treat in case if it's positive. So higher the Centor Criteria, there is a higher risk of streptococcal pharyngitis. Like if the score is 0, there is only 1 to 2.5% risk. But when the score is more than 4 or 4, then the risk is around 51 to 53%. So it is very important to treat the patients with high score with antibiotics. And there is discrepancy among the various guidelines. Some guidelines advocate empiric treatment, while some suggest that even with a score of 4, we need to first do the investigation, test for the streptococcus, and if it's positive, then only we should start the treatment. So if you decide on starting the treatment, the options will include single intramuscular dose of benzathine penicillin G, or if patient doesn't want the benzathine penicillin G, we can start patient on 10-day course of either amoxicillin or penicillin V. And similarly, the patient is allergic to the penicillin, then in that case we can go for the 10-day course of cephalexin, clindamycin or clarithromycin, or we can start the patient on the 5-day course of the azithromycin.